This patient was referred to me for endodontic treatment of tooth number 31 in 2014. So 10 years ago. 10 years ago for endodontic treatment of tooth number 31. She'd received a crown. Afterwards, tooth started to hurt. She went back to her dentist. The bite was adjusted multiple times, and tooth still hurt, to chewing, to biting down on, to cold. And after months of patient suffering, the dentist referred her to us. We diagnosed the tooth as irreversible pulpitis with acute apical periodontitis. We'll talk about number 30 later. But irreversible pulpitis with acute apical periodontitis, recommended root canal. And as you can see, here's the date. As you can see, 2014, so 10 years ago. And this is a CEREC crown. All right, so we went ahead and did the root canal for this patient. Went through the crown and did the root canal for her. Again, we'll talk about tooth number 30 later, but tooth number 31, went ahead and did the root canal for her. Everything went great. We temporized the tooth and referred her back to her dentist. Talked to her about number 30 and the fact that the root canal, tooth number 30, had failed and the root canal needed to be redone. The root canal had failed. You can see a prefab metal post. You get that furcation involvement, periapical lucency here and here. But went ahead and, as I said, just focused on tooth number 31. Told the patient she needed that root canal needed to be redone, and patient left. And again, here's the date. This was immediately after we did the root canal for her in 2014, so 10 years ago. Am I short here? Short fill? Doesn't matter. Doesn't matter if my fill is short. Doesn't matter if my fill is short. All right. So let's find out. So patient came in for me to look at a different tooth just the other day. "10 years post-op of tooth number 31. 10 years post-op of tooth number 31. Here's the date. Tooth is in full function. Patient has no symptoms. So me obturating short, obturating flush, obturating long, doesn't have a negative effect on the outcome of endodontics. And this, what I'm saying, has been proven by multiple studies. The most famous one being Dr. Lin's study that showed short fill, flush fill, long fill. The extent of obturation didn't have any effect on the outcome of endodontics. And here it is, 10 years post-op of tooth number 31. And again, here's the date, as you can see. 10 years post-op of tooth number 31. All right, so next video, we'll talk about tooth number 30. This patient came to see me in 2014 for endodontic treatment of tooth number 31, and I discussed that case with you guys already, posted the video with a 10-year post-op of tooth number 31. But talked to her about tooth number 30 in 2014 also. When I did the root canal on tooth number 31, I told the patient the root canal had failed and the root canal needed to be redone. And patient said, okay. After I did the root canal on tooth number 31 in 2014, patient never came back. She came back 4 years later in 2018. So this would have been the 4-year post-op of tooth number 31. I posted the 10-year post-op of it, but when I saw her in 2018, this would have been the 4-year post-op of tooth number 31. And again, you can see short fill didn't matter. 4 years after I had done the root canal. Again, I posted the 10-year post-op of this tooth, and you saw that tooth had no issues, no periapical lucencies, nothing. We discussed that the other day. But patient said, I said, how come you didn't come back for me to work on tooth number 31 when I saw you 4 years ago in 2014? You're back 4 years later. Patient said, well, now the tooth is bothering me, and now I have a blister on my gum. So, and again, here's the date. So she came back to see me for tooth number 30 4 years after I'd done the root canal on tooth number 31. Because she said there was no pain, so I just let it go. And now suddenly, for the past few months, I've noticed a pimple on my gum, a blister on my gum. So I examined the tooth. Yes, there was a buccal parielis associated with the tooth, Percussion, palpation, tender. Probings were 2 to 4 millimeters. So the probing here was about 4 millimeters, and patient was anxious, so I really couldn't probe it as well as I wanted to. But take a look here, prefab metal post, and take a look here. Remember that trick that I showed you? Sometimes when the extent of lucency is at the same level as the post that's placed in the canal, that sometimes could be an indication of a vertical root fracture. You can see large periapical lucency here, another one here, previous root canal, as I said, all that stuff you see. So I went over all of that with the patient. I said, either you have a tooth with vertically fractured root, or this could be endoperio. I don't know until we redo the root canal, or if I access the tooth, remove the post and all that stuff. If I see a fracture under the microscope, under my surgical operating microscope, then I will tell you to pull the tooth. If I don't see a fracture, we can redo the root canal and see what happens. Patient said, I want to try to save the tooth. Go ahead and see if we can save it. So that's what we did. Again, as you can see, here's the date, 2018, when I saw her for tooth number 30 and do a retreatment. So 2018 would have been what? 6 years ago. So we went ahead and redid the root canal for her in one appointment. Went through the crown, removed the prefab metal post, removed the gutta percha. Okay, take a look. So let me find it. See if I can find it. All right, take a look. Look here. This was immediately after we did the root canal. We redid the root canal. Redid the root canal. Look at all the anatomy there in the apical area. Look at that anatomy there. But look at all that anatomy that the previous dentist who had done the root canal missed. And I didn't find a fracture. I didn't see a fracture under the microscope. This is another angulation. I want to show you another angulation. Nice. Let's see here. Let me see if I can. And my gutta percha is long here. Is that gonna be a problem? I redid the root canal in one appointment. Will that be a problem? Shouldn't I have redone the root canal in multiple appointments? What I wasn't going to show you is I thought I had an x-ray. I think that's probably it. Look at that lateral right into that region, lesion, that furcation lesion that was there. I thought I had a better x-ray of it. You can see it right there. All right. So again, this was immediately after we redid the root canal for her in one appointment. And here's the date. All right. So when I got that lateral into the lesion, then I kind of knew that that lesion, that furcation lesion, must have been endoperio. Must have been endoperio. So my hope was, now that we address all the shortcomings of the previous endo and I was able to get that lateral right into the lesion, hopefully this was endoperio and it would heal. Because we addressed the endo problem by redoing the root canal. Again, here's the date, as you can see, 6 years ago when we redid the root canal in one appointment. Patient came back so I can take a look at a different tooth. And here is the 6 years post-op of tooth number 30. 6 years post-op of tooth number 30, 10 years post-op of tooth number 31. Take a look. The lucency. What happened to that furcation lucency? It healed. It healed completely. So that was endoperio. the original pre-op lesion was endoperio. Take a look here. What happened to my extended gutta percha and all that stuff? No issues. Most of it was just eaten away and resorbed by the patient's body. Remember that huge periapical lucency here? Gone. Healed. Completely. Remember that buccal parielis that was associated with the patient, called it a blister on the buccal? Gone completely. Probings, 2 to 3 millimeters. So 6 years post-op of tooth number 30. And here's the date, as you can see. 6 years post-op of tooth number 30. Tooth is in full function. Patient has no symptoms. So 6 years post-op of tooth number 30, 10 years post-op of tooth number 31. So my gutta percha here was overextended, didn't affect the outcome of endodontics. My gutta percha here is underextended, is short, didn't affect the outcome of endodontic treatment. This is nothing, by the way, as you can see here. Take a look. So 6 years post-op of tooth number 30, we redid the root canal in 1 appointment. There you go. So endoperio, you address the endo, perio takes care of itself. 6 years post-op of tooth number 30, and again, here's the date. Our same patient came to see me for a different tooth, so let me show you that one. I have long-term post-op on it.